Union Health Ministry has issued clinical guidelines for the treatment of COVID-positive children amid concerns that a possible third wave could impact those below the age of 18, given the fact that they are not going to be vaccinated. In a detailed document titled Comprehensive Guidelines for Management of COVID-19 in Children, the ministry said the antiviral drug Remdesivir is not recommended for use in children and steroids should be used only in moderately severe and critically ill children being treated in a hospital setting. The government has also recommended the use of the 6-minute walk test to assess cardiopulmonary issues. Now, the national capital is in for a considerable relief on the COVID-19 vaccination front, with the state receiving key supplies of both vaccines, Covishield and Covaxin. An acute shortage of doses had forced the government to suspend the inoculation drive for the age group of 18 to 44 towards the end of May, till supplies were restored last week. The state has now received 1,27,420 doses of Covishield manufactured by the Serum Institute. This is used for among adults in the 18 to 44 age group only. Besides that, it's also got 20,000 more doses of Covaxin for the same age group. All right, let's now get you an update from Akshay. He's joining us with the very latest. Akshay, it does appear that at least temporarily vaccines will be administered to the 18 to 44 age group with a renewed supply to the national capital.
Well, exactly, Rishika, because we have seen in the month of May, the Delhi government has on several occasions locked horn with the central government over the supply of vaccines. Now, as far as the vaccine supply is concerned, while the Delhi government was saying that the vaccine supply is in shortage in toto, but the age group of 18 to 45 was considerably receiving much lesser vaccines, and this is perhaps one of the largest section of as far as the population is concerned. The Delhi government has been saying that if unlocking starts, they will be wanting to administer more vaccines to this particular age group, because they will be exposing themselves to much more risk as far as COVID-19 is concerned. So after this help from the central government, rather the supply of vaccines from the central government, now it would be possible for the 18 to 45 age group to get the first dose of Covishield, because over 1,20,000 COVID vaccines have been received by the Delhi government of Covishield, that is made by Serum Institute of India, and 20,000 doses of Covaxin for the same age group, which means that the second dose of those that was due of Covaxin, they will be able to get it now. So this is a small respite for the national capital, and remains to be seen that what exactly are going to be the next steps as far as the Delhi government is concerned, because they have been asking for more vaccines, much larger vaccines in number than what they have just received. So let's see whether the central government agrees to that or not.
All right, Akshay, appreciate you for joining us with the very latest. We'll keep a close watch on all those developments. Now, even as the stock of the COVID-19 vaccine seems to have been restored in several parts of the country, including the national capital, vaccine pricing at private hospitals continues to remain a huge cause of concern. A price of 1,410 rupees for the inactivated COVID vaccine Covaxin is very high, particularly since the government was partnering in these trials. So how is it that the Made in India vaccine is the most expensive in India and the third costliest in the world? This when they had said initially that it would be cheaper than a bottle of water. Vishnu with the details.
Is it right to start wondering if a company is making a profit or profiteering? If you take a look at this chart, and let's have that up full frame for a moment, then in rupee prices, Sinopharm is the most expensive. It's a Chinese vaccine, followed by Pfizer, followed by Covaxin. This, of course, is not the price to the government. This is the price to hospitals, private players in the country, which has been capped by the government. But, you know, when it comes to an Atmanirbhar solution, the fact of the matter is that this may be Atmanirbhar, but it is certainly expensive. And the reason I say this is, why don't we compare it with some of the other vaccines we make in India now? The Universal Immunization Program procurement of pentavalent vaccines this year will be at the price of 17 rupees 37 paise for Serum Institute and Biologic E. Just think about it. These are complicated. 17 rupees 37 paise, and this was how much? More than 1,200 rupees. Another example, the price of measles vaccine supplied by Serum Institute to UNICEF which is also a live vaccine, 39.6 US cents, that's 30 rupees a dose. Therefore, a price of 1200 rupees for the inactivated COVID vaccine is very high, particularly since the government was also a partner in having organized trials. But it's difficult to say. A company can say, look, we have incurred these huge costs, huge facilities. We will never know because it is opaque.
All right, on to the other big development we're tracking. The Bihar government now is facing a lot of criticism over what the opposition describes as fudging death tolls as far as COVID-19 casualties are concerned. After the Patna High Court, there's been a revised audit and the figure has now gone up to 9,429. There have been 3,951 deaths added after the audit was completed. That's almost a 72% discrepancy. Deaths are up 72% after that audit. So this, of course, is the big development that we're tracking. For more details and to understand what this actually means, let's go across to my colleague Manish, who's been tracking the details of this story. Manish, after this audit, deaths are now up 72%. This raises several questions on whether it's not just Bihar, but even several other parts of the country where deaths are being underreported.
Risika, more than questions this whole entire audit, which was ordered by Patna High Court, which is monitoring the COVID situation in the state, has also answered so many questions which was being in the public domain. First is that if you take an audit, the death toll, whether it is in Bihar or in any other state, it is likely to go up. Also, the state government, Bihar government officials, they are still maintaining that this figure might go up because they are not ruling out that several cases are still, ignored or left behind because of not proper paperwork, done by the local officials or the, health department officials or the private hospitals where they were admitted. So they are saying that, yes, of course, there was some kind of omission which they have now tried to correct, but this might need further correction in the days to come. Risika.
Right. Well, Manish, I also want to ask you, because what you're saying is very interesting. You're saying that this death toll could actually be higher, and your report also suggests that if you look at the revised death toll for Patna, it still doesn't match up to what the crematoriums, the official government-run crematoriums, are reporting in terms of the total number of cremations carried out with COVID protocols.
Risika, as far as that anomaly is concerned, I spoke to the Pratyay Mrit, who is Principal Secretary of the Health Department. He said that this is being made an issue out of sheer ignorance because several people who came from outside Patna district, and they died in the local hospitals, whether government hospital or private hospital, because the death took place due to COVID, so they preferred to cremate them here and go back home. So, but when it came to final death toll, so we took that person case in that particular district from where they they belong to, or from where they were referred to hospitals in Patna. That is why this kind of anomaly is there. Risika.
All right, Manish, appreciate you for joining us with the very latest. So the clarification coming in from the health department as far as the discrepancy in Patna is concerned is that these were people who came in from other parts of the state to seek medical help in the state capital. We'll keep a close watch on all those developments. Meanwhile, let's get you the other big story that we're tracking from Mumbai, where 11 people have died and 7 injured after a double-storey residential building collapsed on another structure at a slum in suburban Mumbai late on Wednesday night. 8 children are reportedly among the 11 dead. Many are still feared to be trapped under the debris, and an evacuation process is underway. The BMC said that they are evacuating people from another 3-storey structure nearby, which is also in a dilapidated condition. Locals and search teams helped in the rescue operation. Those injured were taken to a hospital in suburban Kandivali. The monsoon, remember, arrived in Mumbai yesterday. Heavy rainfall was reported in several parts and is expected to continue for the coming few days. Let's go right across to Purva Chitnis, tracking the details of the story. Purva, unfortunate developments that you're reporting on as far as this building collapse is concerned. What more can you tell us? Was there structural damage that could be perhaps linked to the heavy rain that Mumbai saw yesterday?
Well, whenever there is a monsoon in Mumbai, there are dilapidated buildings in Mumbai which, unfortunately give up. And yesterday also we received, over 200 mm of rainfall in a span of 9 hours. And that is also the reason cited that, this portion of this house collapsed on another structure, and that is the reason. Unfortunately, 11 people lost their lives and 7 have been injured, which have been taken to the nearby hospital as well. So the BMC says that the BMC and Fire Brigade is still carrying out the rescue operation to just check if there are more people who are feared to be trapped inside the debris or not. But as far as the rainfall is concerned, well, again today there is a in rainfall again there is a heavy alert which has been the heavy alert is being issued for today as well. Heavy rainfall is expected today as well. Yesterday 200 mm plus rainfall was received, and that is in fact nearly 44% of June's monthly average. So that is the kind of rainfall that Mumbai received just on the first day of monsoon, which was arrived in Mumbai yesterday. And even for the next 4 to 5 days, we can expect the IMD has issued an orange alert for Mumbai. And today as well, there is overcast, and you can expect that rainfall to happen today as well. And around 12:15 is when the high tide is expected. So if the rainfall coincides with the high tide, then in that case there can be waterlogging which will be reported like we saw yesterday. So the next 4 days are going to be again crucial when more rainfall is expected in Mumbai.
All right, thanks Purva for joining us with the very latest. So more rainfall expected in Mumbai, high tide expected around noon, 12:15. And if it is raining heavily at that moment, then you could in fact see once again scenes of waterlogging, especially in the low-lying areas. Let's now shift our focus to Tamil Nadu, which is seeing a dip in the COVID-19 cases. There have been 17,321 cases versus 8,000 yesterday. There's a dip of almost 4% in the COVID-19 cases, and this is a sustained dip in cases in Tamil Nadu now for the 19th straight day. Deaths are also down by a percentage with 405 deaths reported in 24 hours. Let's go right across to Sam Daniel joining us for the very latest. Sam, there appears to be a consistent decline in COVID-19 cases and deaths over the course of the last 19 days now.
That's right. In mid-May, Rishika, we had 38,000 plus cases, and there's been a slight dip consecutively for the last 19 days, and now it is hovering around 18,000. The worry, of course, is although the numbers are dipping, the mortality rate is hovering around in terms of real numbers around 400 every day, and this is a cause to worry. In Chennai, over the last 24 hours, there's been a 23.8% rise in deaths from 42 the day before to 52 people losing lives to COVID yesterday. Authorities say this is because the positivity is quite high, 18,000 every day. And in terms of percentage, they point out it's still 1.22%, which is along the national average. But in terms of real numbers, this leads to worry. And authorities also point out this is also because many elderly people are brought quite late for treatment to hospitals, and they want people to rush them to hospital the moment they find symptoms. Otherwise, in terms of numbers, the western part of Tamil Nadu is still giving concerns. For example, districts like Coimbatore, Tirupur, they have high numbers. For example, Erode is having 1,405 cases. Coimbatore continues to be the single city accounting for a large number of 2,000 plus cases. And here again, authorities are focusing on high testing, more fever clinics, and again have appealed to people to report for testing the moment they find symptoms. We expect some kind of orders in terms of further relaxations by the Tamil Nadu government with this new declining trend over the last 19 days. Will they offer or announce more relaxations from this Monday? That we expect later today or tomorrow.
All right, Sam, appreciate you for joining us with the very latest. We'll keep a close watch on those developments, and of course one hopes that trend, in fact, the downward trend in cases continues. Let's now get you the big story we're tracking from Delhi. The Delhi government recently announced several COVID relief measures, one among them being free rations without any paperwork. But an NDTV reality check reveals that the centres which are supposed to distribute this free rice and wheat to the poor have run out of stock. Sukirti with the full story.
धक्का धुक्की करके ये सब लोग आ रहे हैं, मारपीट करके भगा दे रहे हैं, कुछ भी नहीं दे रहे। 2 बजे तक आना, फिर बोलते 4 बजे आना, राशन तो देते नहीं है, फिर आपस चले जाते हैं। हम तो अब क्या करें, रोज बहुत दुखी कर रखे हैं, बहुत दुखी कर रखे हैं। अब क्या करें, हम आज भी आए, अभी भी बोल रहे हैं राशन नहीं मिलेंगे, अब घर जाओ। पब्लिक को भगा देते हैं।
30-year-old Sudha Devi has been queuing up at a government school but has been turned away because stock has run out. The Delhi government had started this scheme on the 5th of June to give 4 kilos of wheat and 1 kilo of rice to people who are not ration card holders but soon ran into shortage issues. The scheme was meant to help those like 28-year-old Priyanka from Bihar who used to work as a maid in Delhi but does not have a ration card. But with no stock at the ration centers, she is desperate.
हम लोग का यहाँ का कुछ आधार नहीं है तो कैसे बनवाएंगे, ना बिजली बिल है ना कुछ है, मकान मालिक अपने देता ही नहीं है, तो ऐसे नहीं बन पाया है राशन कार्ड।
कहाँ की रहने वाली है?
बिहार का।
बिहार में कहाँ?
बेतिया जिला।
बेतिया, तो बेतिया का आधार कार्ड है आपके पास, यहाँ का नहीं है?
यहाँ का नहीं।
But activists question the government's estimates.
Unfortunately, the Delhi government, even after the order of the Supreme Court, said that they will give rations to only 20 lakh people this time, and to begin with to only 2 lakh people. Now, we knew from the very beginning, and we have been saying this to the government, that this is grossly inadequate.
The lockdown has already destroyed the livelihoods of so many people, and the government will now have to make extra efforts to ensure that they at least get 3 square meals a day. In New Delhi with camera person Sanjay Kaushik, this is Sukirti Dwivedi for NDTV.
Welcome back. Let's get you the big political story we're tracking from West Bengal. Now, there have been reports of a lot of rumblings within the BJP unit in West Bengal after the poll debacle. Many even saying that there are those who switched over from the TMC to the BJP now wishing to come back. But here's the big focus. Mukul Roy's ghar wapsi to the TMC. Is it a possibility? Will he quit the BJP? Why are these questions being asked? Let's break it down for you. Now, Mukul Roy, while he was in Kolkata, had skipped a key meeting of the BJP unit that took place in Kolkata. Now, there were 2 people who skipped this meeting. One of them was, of course, Mukul Roy, and the other crucial sort of absentee in this all-important meeting was, in fact, Shuvendu Adhikari. Now, Shuvendu Adhikari, of course, as you're all very well aware, was Mamata Banerjee's right-hand man who switched over to the BJP and challenged her from Nandigram and won. Now, why are questions being asked on whether Mukul Roy will quit? Because Shuvendu Adhikari, who is the other absentee at this meeting, was actually in Delhi at that time and was meeting with the top leadership of the party in Delhi. But Mukul Roy, remember, was in Kolkata. This is, of course, sparked off a lot of speculation. Now, Mukul Roy was in Kolkata, but he didn't attend the meeting. But what sources also tell us is that Mukul Roy's wife is critically ill and in hospital. Now, while his wife is battling for her life in hospital, the Prime Minister has called Mukul Roy earlier to inquire about his well-being. This is a conversation that has happened between the Prime Minister and Mukul Roy. This is what sources have confirmed to us. But it's not just the Prime Minister. The other person who's called on Mukul Roy while his wife has been in hospital has been none other than TMC's Abhishek Banerjee. Now, this makes things very interesting. There was a meeting that happened between Abhishek Banerjee and Mukul Roy. Was this a courtesy call, given the fact that Mukul Roy's wife has been in hospital, or is there more to read into this political development? That's what the big question is. But at the end of it all, the reason why speculation continues over Mukul Roy's possible exit from the BJP is because he continues to remain silent. He hasn't issued any clarification on this speculation. He hasn't denied it. So questions continue to be asked on whether he will quit the BJP and join the TMC once again. His son has not ruled out returning back to the TMC fold. So that, of course, is the big political focus from Bengal. We'll continue to get you all the very latest. Short break here. We'll bring you more news on the other side. Welcome back. On to the other big story we're tracking today. Doctors at the Gangaram Hospital in New Delhi have successfully treated patients suffering from COVID-19 using the monoclonal antibody therapy. The two patients who were administered the antibody cocktail designed to produce resistance against COVID were discharged within 12 hours of being given the doses. Now, these patients were administered the monoclonal antibody cocktail within the first 7 days of a rapidly progressing COVID. NDTV Sonakshi spoke with the doctors.
As India continues to battle the deadly coronavirus, monoclonal antibody therapy, a possible game changer in the field of medical science, and as doctors and experts are continuously finding new ways and experimenting with new ways of dealing with the virus and curing COVID patients. Joining me right now is Dr. Rana, the Chairman Board of Members at the Sir Gangaram Hospital in the national capital. Sir and Doctor, thank you very much for speaking to us. Doctors in your hospital have successfully treated two patients using the monoclonal antibody therapy. For our viewers, in simple language, what is monoclonal antibody therapy, sir?
Monoclonal antibody are based on the principle that these antibodies against virus, S protein, they are produced in the laboratories, and then when they are given to the patient early in the disease, say once the patient is symptomatic and is given early within 1 week, then these monoclonal antibodies attach to spikes of virus, and the virus is inactivated. That virus cannot attach to the cells, so it cannot replicate, it cannot multiply, so patient will not get disease. So around this drug has been tested on for 20,000 patients in the lab, clinical trials, and they have found that in symptomatic patient, early symptomatic patient, this treatment, which is just single injection given intravenously or subcutaneously, can prevent symptom to the extent of, or disease, can prevent the disease to the extent of 70%. Okay. There are some new antibody which can prevent the disease to the extent of 95%. So in that way you can think it is something like an antibiotic which is used for bacterial disease,
Doctors at your hospital have treated two patients. One is of the age 36 and one is of the age 80. The one with the case study whose age 80 has comorbidities. Can you elaborate a little bit on that? How effective could this be? Could this be a game changer?
Yeah, one who was symptomatic at the age of 80, having diabetes mellitus and hypertension, if he gets disease, he has got fairly good chances of getting morbidity and mortality also. So to the tune of 70%, that person is not going to get disease. Right. So time will tell. Another 5 days we will come to know whether this person gets disease at all or not. Similarly, the other person, the young doctor who was involved in taking care of COVID patients, So there we have given to him also that he should not get any disease at all. That you give injections subcutaneously or intravenously, wait for a few hours and patient goes home, So there is no burden on the hospital beds. Apart from cutting the chance of getting disease, thereby morbidity and mortality, it is cutting the need for hospital beds. And that way it will be quite a game changer actually. It will reduce the burden on the infrastructure actually.
All right, well, breaking news coming in at the moment. We have the latest 24-hour COVID numbers from the country. 94,052 cases reported in the last 24 hours. Deaths are up to 6,148. Now, the death toll has risen by almost 4,000 compared to the previous 24-hour figures. Remember, due to the correction in the Bihar death toll that was done after the Patna High Court ordered a death audit. So, the 72% rise in COVID-19 deaths in Bihar has actually led to this high death rate of 6,148. Active cases in the country currently at less than 12 lakhs. lakhs. It's at 11.67 lakhs. 33 lakh people have been vaccinated in the last 24 hours. COVID testing continues to remain above the 20 lakh mark, with the positivity rate in India at 4.69%. And it is for the third consecutive day now that the positivity rate in the country is below 5%. Well, on to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions you may have about the COVID-19 vaccine. Dr. Swapnil Parekh, doctor and author of The Coronavirus, Everything You Need to Know About the Global Pandemic, joins us on the broadcast. Thanks, Dr. Parekh, for sparing your valuable time and being with us on NDTV. The most commonly Googled question, I think, is around vaccine safety. And while, of course, you know, a lot of people are going out and getting the vaccine, a lot of people are still hesitant. What would you like to say to them?
Thank you so much for having me. Whenever we talk about the risks of vaccination, we have to always talk about the benefits as well. And we know that COVID-19 is a potentially highly lethal condition. It's caused by a very dangerous virus. And we know that the vaccines take away a huge chunk of that risk. Once you're vaccinated, your chances of hospitalization, death, severe disease are drastically reduced. So the vaccines are taking away a massive amount of risk, and there is a small percentage of chance of some side effects which are generally temporary, mild, can be managed by over-the-counter medication.
Right.
So net, the vaccines have a huge amount of benefit, and that benefit exceeds any risks. So please do get vaccinated when it's your turn.
All right. So any risks associated with the vaccine are very low compared to the benefits that the vaccines have. But it's interesting that you say that a lot of the side effects that are being caused as a result of the vaccines can actually just be dealt with, you know, by simple medication. What is this medication, and should you see a doctor if you have side effects like even a mild fever after vaccination?
So there are two kinds of side effects that we are essentially concerned about with these vaccines. The first are the what we call reactogenic symptoms. So this is like fever, feverishness, chills, body ache, fatigue, headache. These are easy to manage with rest, hydration, over-the-counter paracetamol if required. And yes, of course, stay in touch with your doctor. See a doctor. You can go to the center where you were vaccinated if necessary. And the second are the slightly more severe kind. There can always be allergic reactions with vaccines, but all the systems are in place at the vaccination center to deal with these allergic reactions and save lives if they do happen. They're very rare.
Right.
There's been a small risk of blood clots, a very, very, very small risk of blood clots. So if you have a persistent headache or swelling in any of your legs, change in color of any of the limbs, if you have symptoms like this, alarming symptoms, you absolutely need to seek medical intervention.
Right.
Do not delay it. Even these symptoms are treatable, and most importantly, they're very, very rare.
All right. I think those are all important clarifications, and of course important markers also that you need to be aware of when you do go out and get yourself the COVID-19 vaccines. The other question is about vaccine efficacy. Are vaccines effective in preventing you from getting COVID?
When we talk about efficacy, we have to understand that efficacy can be against asymptomatic infection, against symptomatic disease, mild disease, severe disease, and death. So far what we have seen is that the AstraZeneca Oxford Covishield vaccine has been studied in real-world studies and clinical trials across the world. And we have seen that with 2 doses, there is a high level of protection against hospitalization and death. There is some protection against asymptomatic and mild infections as well. With Covaxin, we're awaiting for the phase 3 clinical trial and real-world data to be released. And we hope that that also, like Covishield, provides very strong, very high efficacy against severe disease, hospitalization, and death. And the efficacy against mild and asymptomatic disease might be lower than that against severe disease, hospitalization, and death. But that's the case with many vaccines. They protect you against the most severe outcomes. But if it converts COVID-19 from what was a lethal disease into a mild flu, I think that's something that would be very
And this will hold true even for the new variants?
What we are seeing so far in the UK is that with the Delta variant, that there is some loss of efficacy against mild or asymptomatic infections, especially with one dose versus two. But with both doses, the hope is that the efficacy against this variant and all future variants, the efficacy against severe disease, hospitalization, death is retained. In fact, at a recent coronavirus conference, there was very exciting new research presented to show that the existing vaccines do retain T-cell reactivity, even though the antibody response neutralizing antibody response may decrease. T-cell reactivity is preserved against all variants.
Well, I think those are important clarifications. Bottom line, vaccines are safe and vaccines work. You still need to follow COVID-appropriate behavior, wear a mask, but it will definitely save you from a severe disease and can even reduce the chances of death. Thank you so much, Doctor, for sparing your time and being with us on NDTV.
Pleasure.
Well, the other big development we're tracking, India may have passed the peak of the second wave, but there is, remember, the looming fear of a third wave, a potential third wave that could hit the country. Now, this, of course, is linked with COVID-appropriate behavior, but as India unlocks, there are worrying scenes of violation of social distancing, people seen in marketplaces, for instance, without masks. This is a full story.
Similar scenes from across the country. Crowds and many not wearing masks. Even though most states are seeing thousands of cases every week and the ferocious Delta variant of COVID is still around. In UP, crowds are back in many towns as restrictions eased but had dropped their masks. When confronted for COVID violations, almost everyone has an excuse. In Noida as well, crowds have started to drop their guards after the reopening of the markets, despite the city facing overcrowded hospitals and a shortage of oxygen for COVID patients barely a month back.
आज भूल गए मास्क घर पे भूल गए।
अच्छा, कोरोना का डर नहीं है क्या?
नहीं डर है सर।
फिर मास्क नहीं पहन रहे हैं?
मास्क पहनेंगे अभी जल्दी में सर।
जल्दी।
At many places, even the presence of police is failing to ensure COVID-appropriate behavior.
अब नहीं फैला, ऊपर वाले ने चाहा तो।
ऊपर वाले ने चाहा, आपने चाहा, आप मास्क नहीं पहनेंगे तो?
हम तो मास्क पहने हुए हैं।
Life slowly returns back to normalcy. The crowds have again started to reappear back on the roads. The concern, however, regarding strict adherence to COVID-appropriate behavior remains, and not only in Delhi NCR, but across the country.
In Karnataka, which is seeing as many as about 14,000 cases a day, there's COVID fatigue and flouting of rules in the markets. The situation is the same in various other states, which has worried the experts who have warned of a possibility of third wave across the country.
लॉकडाउन है, लॉकडाउन तो अभी एक बैक सरकार को खोलना नहीं चाहिए। ये अभी जैसे 2 बजे तक है तो 2 बजे तक ही रहना चाहिए, क्योंकि संपूर्ण लोग तो अभी टीका ले नहीं पाए हैं। इससे तो संक्रमण तो बढ़ने के चांसेस ज्यादा है।
COVID fatigue is considered one of the main reasons behind the second wave of COVID-19 wave in our country. The healthcare experts have warned that any kind of laxity may wipe out all the gains that we have achieved against COVID-19. With camera person Prem Singh and Adnan in Hapur, I'm Akshay Dongre for NDTV.
A 34-year-old auto rickshaw driver in Madhya Pradesh's capital of Bhopal has turned his bread-winning vehicle into a free ambulance service. He has transformed his three-wheeler into a 24/7 ambulance service equipped with an oxygen cylinder, hand sanitizer, PPE kit and an oximeter. Lottoland will support Javed Khan's cause with a cash incentive of 1 lakh rupees.
Javed Khan. Before the pandemic, he was just another auto rickshaw driver. But when he saw how the pandemic left people stranded for medical help, the poor often carrying their COVID-hit family members on their backs to hospitals as they could not afford an ambulance. Javed, a father of 3 children, sold his wife's gold necklace to turn his auto rickshaw into an ambulance.
बहुत सी समस्या हुई, रोडों पे देखा मैंने, एम्बुलेंस नहीं मिल रही, लोग तड़प रहे हैं, कोई ठेले पे लेके जा रहा है, कोई हाथ में सिलेंडर लेके मरीज को लेके जा रहा है लगाते हुआ। तो हमने सोचा कि कौन ऑटो को हम एम्बुलेंस बनाएं। तो हमने बीबी एक वो था सोने का लॉकेट, हमने उसको बेच के एक सिलेंडर लिया और उस सिलेंडर का मीटर लिया और हमने सैनिटाइजर लिया और ये मीटर लिया और किट ली, हमने पूरा बंदोबस्त करा गाड़ी के अंदर। तो ये गाड़ी ऑटो कंप्लीट हो पाया, ये एम्बुलेंस के लिए तैयार हो पाया।
He started ferrying patients for free, this despite the fact that he has a family of 3 to feed and was also supporting 2 brothers, daily wage earners who had no source of income in the lockdown. His ambulance is equipped with an oxygen cylinder and an oximeter. A doctor taught Javed how to use equipment. A donor further helped with another oxygen cylinder and an oximeter. One of these people he helped, Jabir Khan, says Javed also refused to take money for his services.
ऑटो को इसलिए बुलाया था क्योंकि एम्बुलेंस को कॉल कर रहे हैं, एम्बुलेंस हर जगह बिजी है। अब जिस तरह से विस्फोट हुआ है तो आने में बड़ा टाइम लग रहा है। अब मुझे कहीं से नंबर मिला था इन ऑटो का, मैंने उस पर कॉल किया, कॉल करने के बाद सडनली वो आ गया। लेकिन आने के बाद जब अपने पेशेंट को वहाँ पर बैठाया, उसके अंदर देखा तो वो पूरी फैसिलिटी जो उन्होंने ऑटो में बना रखी है वो एक एम्बुलेंस की तरह थी। ऑक्सीजन सिलेंडर से लेके मतलब टोटली इंस्ट्रूमेंट उनके पास मौजूद थे। तो इस तरह से ऑटो वाले भी मदद कर रहे हैं इस कोरोना काल में, तो ये बहुत ज़्यादा मतलब अच्छी बात है। और ये मानवता का एक वो है कि जो ये बता रहा है कि अभी मानवता मरी नहीं है।
Shortage of oxygen beds, crematoriums and burial grounds struggling to cope with the dead and the healthcare system stretched to breaking point, but people like Javed Khan do more than just a service. They help restore faith in humanity.
पूरी सेवा फ्री है, व्हाट्सएप पे फेसबुक पे मेरा नंबर चल रहा है, मुझे फ़ोन आते हैं, मैं तुरंत उनके पास जाता हूँ और ये पूरा करता हूँ। मैं परेशानी को उठा लेता हूँ मगर मैं उनको परेशान नहीं होने देता, क्योंकि मानव सेवा सबसे बड़ी है, मानव को बचाना है हमें।
Welcome back. Let's get you an update from the markets this morning. As far as the Sensex is concerned, let's get that on our screens. The Sensex is in fact in the green right now. All right, so the Sensex up almost 150 points, 0.28%. It is trading at 52,085. Let's take a look at the top gainers on the market this morning. Indiabulls Housing, Yes Bank, Gail India all continue to be in the green. Indiabulls Housing up 3%, trading at 270. Yes Bank up almost 2%, trading at 14.48. And Gail India up almost 1.66%, trading at 164.90. Let's also bring you up to speed with the top losers. As far as the Sensex is concerned, Eicher Motors, Adani Ports and SEZ and Hero Motorcorp all continue to bleed. Eicher Motors down almost a percentage point, trading at 27.01. Adani Ports and SEZ also down almost a percentage point, trading at 847. Hero Motorcorp down 0.38%, trading at 3,011. The BSE top gainers, Reliance SEP, Composoft and Akash Deep. Well, Reliance SEP is trading at 57.92 in the green, at currently 50.85. Composoft is trading 20% in the green at 15.12 and Akash Deep is trading at 46.80. BSE top losers, Diwan Housing, Suncare Traders and Mohtind all trading in the red. Diwan Housing down almost 10 percentage point, trading at 18.55. Suncare Traders Limited also down 9.21%, trading at 0.69. And Mohtind also down by 7%, trading at 7.31. Let's take a look at the oil and gas stocks and how they're faring this morning. GAIL India is up, like we said, about 1.5% points, trading at 164. ONGC Oil India also in the green, ONGC at 124 and Oil India at 141. All right, healthcare stocks, Morpin Labs, Natco Pharma and Glenmark Pharma all in the green. Morpin Labs is 2.69% up this morning, trading at 62.90. Natco Pharma up 1.78 points, trading at 1,086.95. And Glenmark Pharma also in the green, trading at 1.21% in the green at 630. Auto stocks, Tata Motors in the green by almost a percentage point, up to 346. Maruti Suzuki is down currently, trading at 7,213, and M&M is up, trading at 807.3. Let's take a look at the Sensex once again, now up 160.78 points, trading at 52,102, up 0.31% as of 9:55 this morning. We'll keep a close watch on the markets. That's all for now. We'll bring you up to speed with more news on the other side. Stay with us.